Good afternoon, everyone, and welcome to the Board of Pharmacy's update on COVID-19 webinar. I'm Tom Glenski, Chief Inspector with the Board of Pharmacy. With me today is Kim Grinston, our Executive Director. We're doing this webinar remotely, so please bear with us if we have any technical difficulties today. We have a lot of people on the call. We have about 4 times the number of usual registrants. So I'm sure there's people on here that haven't been on our webinar before. So I'm just going to go through a few things. Everyone's in listen-only mode. If you have trouble connecting via your computer audio, there is a telephone call-in audio option on your GoToWebinar toolbar that you can use and call in if you're having trouble. We are providing CE for today's webinar. To be eligible for CE, you must be signed in under your own name to the GoToWebinar website. I'll go over CE instructions at the end of the webinar again. And just a reminder, you need to save your certificates. We do not submit CE to the CPE monitor. Okay, so I'm going to back up one. I heard my screen wasn't being shown, so I'm going to back up a slide here. So here's what it looks like if you need to connect via the telephone audio on your webinar toolbar. We did not get handouts posted yet on our website, but I did just 2 minutes ago send an email out to all the registrants that have the handouts attached to there. So if you check your email inbox right now, you should find that as an attachment. We will post them later on our website along with the recording. We'll try to get the recording up as soon as possible, and it'll be on our website. We hope to be able to take questions at the end of the webinar today. If you go to your GoToWebinar toolbar, you can type in your question and send it to us, and we will try to answer some of them at the end of the webinar. I'm now going to turn it over to our Executive Director, Kimberly Grinston.
Thanks, Tom, and good afternoon, everyone. We want to thank everyone for joining us on this call. Of course, given the circumstances, we had a bit of a short notice for the webinar, but currently we have over 800 people joining us, a lot of people on the call. We are going to try to give as much information as we can and also take a few questions at the end. A few changes on the webinar. The webinar is scheduled for an hour. We do have some additional time after that hour ends to answer questions should we run over. For CE purposes, you only need to be on the program for the hour, but if you'd like to stay the additional time and hear and or have a question answered, we will do that. We know that these are fast-moving times. There's a lot of information being moved around. There is also a lot of information coming out from the board. If you are like me, you're getting a lot of COVID-19 related email messages, and we are going to try to monitor that, but there's a lot of information that we are pushing out to licensees right now. As Tom mentioned, we are doing this remotely, so Tom is controlling the slides, so please bear with us if we have any technical difficulties. Why don't we go ahead and get started. So first, I want everyone to know, if you haven't already gone to the board's website, the board has set up a COVID-19 informational website. It includes links to information from the Department of Health and also statements and guidance documents issued by the Board of Pharmacy. So that would be your best resource, and we would suggest that you start there because a lot of your questions may be answered there. Next slide, please. Some of the documents that we have currently on the board's website, and Tom, you can scroll down if you can. We have the board's initial COVID-19 informational statement. We have a office license update statement that was issued on March 17th. March 18th, the board issued an initial waiver of statutes / administrative rules guidance document. And on today, this morning, the board issued a supplemental waiver guidance document to provide some additional clarification on what went out on last week. Next slide, please. We're going to look at a couple of things on the webinar today, just so that you know overall the COVID-19 updates.
Kim,
We're going.
Kim, this is Tom. Just want to let you know it's taking probably 15 seconds or more for slides to change after I click it. So that's what the
Okay.
delay is.
Thanks, good to know. We're going to be looking at office administrative updates, some licensing issues, some issues related to waivers, a few miscellaneous things that we'd like to tell you about, and then of course take questions. As you know, this is a very fluid situation. So Tom and I were working on slides maybe 20 minutes ago. We have some information that's changed since then. So if there's information that's different from the slides that you see, it's because again, things are moving very quickly. So as of right now, this hour, the board office is open and processing applications. Due to volume, we are asking people to please email the board office instead of calling us. Our main email address is missouribop@pr.mo.gov. It's on the screen and on your slides. Also, our inspector email addresses and phone numbers are available online. Now, this is current as of right now. I believe that situation may change. For those who are monitoring the news, the governor's office did issue something about state office buildings. Should we have to go into a full remote operation, the board is equipped to do so. We will, however, be experiencing some mailing delays. What that means is that you will still be able to call the board office. We are asking that you email first because we have multiple people responding to emails. We will have limited availability to address the board's main office line, but we will have staff working and processing applications to the extent possible, although a mail delay is anticipated. But hopefully some of the information we share today will help address some questions that you may have if we do have a mail delay. To find our inspectors, if you go to the website under board information and click on inspectors, you will find a list of inspector email addresses and also phone numbers. Next page, please, Tom. Again, we have the COVID-19 informational page. Please continue to visit that because information is being added frequently. I believe by the end of this webinar, we will add another document to the website. Let's begin with licensing and talk about some licensing issues. I'm going to move over this a bit quickly simply because I want to get to the waiver pieces because that's where we are getting the most questions. So right now we are getting the most questions about pharmacy technicians and whether they can work. We understand many of you are moving staff in between different sites. Also, we have people that are being moved to employment and applying as new technicians. Techs can begin working once a completed application is mailed to the board. This is not anything new. This is currently in statute. So once a tech sends a completed application to the board, you can begin working in the pharmacy, provided that a completed application must be kept in the pharmacy. Under normal circumstances, a completed application would require a receipt showing that the applicant has submitted their fingerprints to an authorized testing site. During the state of the emergency, the board has waived that fingerprinting receipt requirement. So what technician applicants will need to do is still register with MOCS, which is the Missouri Criminal History System. Information on this is on the board's website. If you are unable to get fingerprinted, and we understand that you probably will not be, the board is asking that applicants be fingerprinted as soon as reasonably possible. The board will be following up for those applicants who do apply during the state of emergency if we do not have your prints, but we are making that allowance so that you can begin and move new technicians to work. Again, this is only during the state of emergency. We've gotten requests about the tech renewal deadline, which is currently May 31st. Right now, that deadline is still the same. We are asking people to renew online, and should that change, and it may, we will send out information on that. For pharmacists applying, exams have been temporarily suspended by Pearson VUE and NABP. You can still apply with NABP, but you cannot schedule an exam. That situation is fluid as well. We anticipate that will change over the next couple of weeks. We are going to give you some information about non-resident licensing waivers that were issued or approved by the board this morning. Statement went out earlier today. We'll provide more information about that in a little bit. For those pharmacists who are immunizing or administering medication, many of them, our rule requires either a CPR or BLS, healthcare provider level certification. I understand some of those certifications are expiring right now. We've received questions on whether you can continue immunizing, and the answer to that question is yes. We're asking that you please, though, complete your CPR BLS course as soon as reasonably practical. The governor's office has issued two executive orders that relate to the state of emergency and the waiver. They are recognized on the screen. Next slide, if you please, if you can. We're going to walk through just a list of those waivers. In the interest of time, won't read this entire screen. We're going to walk through each of these individually, but these are the waivers that the board has issued as of today, as approved by the governor's office. So the first one I'd like to talk about is emergency dispensing, and Tom and I are going to tag team, so he will add information as we go through the slides on the waiver pieces. First, as you all know, Section 338-200 authorizes dispensing an emergency supply of medication if a prescriber is not available to get refill authorization. That statute is currently in effect. However, two waivers have been granted. Number one, the current statute currently provides that the pharmacy dispensing the emergency supply, must have previously dispensed or refilled the prescription for the same patient. The board is waiving that. So if you have a patient who comes in, you are unable to get in contact with the prescriber, and I really want to stress that this is if you are unable to reach the prescriber for whatever reason. Offices may be closed due to COVID-19. They may not be responding. Even if you did not originally fill or refill the prescription, you are now authorized to dispense an emergency supply. The current statute limits an emergency supply to the amount needed during the emergency period, but not to exceed a 7-day supply. The board has waived that and is authorizing a 30-day supply at this time. The board has received requests to extend that 30-day supply to possibly 90 days or even longer. That is under consideration by the board. It has not been approved, but as of right now, a 30-day supply is authorized. Let's talk about non-resident licensure. Portability, because this waiver probably won't impact and be quite a sea change for a lot of those on the call. In order to treat patients, as you know, we are really having stress areas throughout the state. The governor authorized the Board of Pharmacy to waive licensure requirements, meaning the requirement for a Missouri license for pharmacists, pharmacy technicians, and pharmacies that are licensed in another U.S. state or territory. So this would not apply to foreign licensees. It would only apply to those who are licensed and in good standing in another U.S. state or territory. What the waiver will allow you to do is allow a pharmacist, technician, or pharmacy licensed in another state to provide services and or practice in the state of Missouri to assist a Missouri licensed pharmacy. This is not an open waiver where a pharmacist or technician may come in and offer services just generally. It has to be to assist a Missouri licensed pharmacy. The governor's office is asking and is looking at other waivers at this time, but that requirement is currently in the waiver. Thanks, Tom. Next slide, please. If you are an individual, and this does not apply to pharmacies, but if you are a pharmacist or using a technician that is not licensed in the state of Missouri, but is currently licensed in another state, the board is asking that you complete an emergency practice notification form, which is on the board's COVID-19 website page. We are also going to update this and add it to our applications page. online. But for right now, IT, as you can imagine, state IT is doing just quite a bit of projects right now. And it may take a day or two for us to post that form. But essentially, it is a one-page form. There isn't a fee required for that. It basically asks who is going to be practicing or assisting a licensed pharmacy. It asks also for a license number and licensing state, and also the pharmacy that the individual will be practicing for and or assisting. Now this is a one-time form. So once you file the notification form, it's not necessary to file again or to notify the board office should you change practice sites. So let's say you're working for a chain, or you are moving in between hospitals, or you're working for multiple independents as a relief pharmacist and or doing some maybe non-dispensing remote activity. Once you notify the board, that notification will allow you to assist any Missouri licensed pharmacy. However, the Missouri licensed pharmacy should keep a copy of your notification form on site. You see a copy of the form online right now. Again, it's attached to the supplemental waiver statement that went out on today. Next slide, please. I want to remind pharmacies, though, if you're using someone who's unlicensed, that the pharmacy is still responsible for pharmacy services that are provided. We would encourage you to make sure you are vetting individuals who come in. Also, in order to use someone who is not licensed in the state of Missouri, but licensed in another state or territory, you should also maintain proof, or have to maintain proof, that the individual holds an active license in their home state. So what does that mean? The board will accept an online license verification, a copy of their license that shows the license is current and active. Pharmacies should make a good faith effort to make sure that whomever you're using to assist, if they're not licensed in Missouri, that they are licensed and active in their home state. Class J shared services. During the state of the emergency, we understand that pharmacies are helping pharmacies in the state with meeting patient needs. That includes Missouri licensed pharmacies helping another Missouri licensed pharmacy, and also non-resident pharmacies that may want to assist a Missouri licensed pharmacy. So you have a pharmacy on the Illinois side that is assisting a pharmacy on the Missouri side, might be a good example. During the state of emergency, the board is waiving the Class J permit requirement if applying for a Class J permit cannot be reasonably done. So if you have everything in place to apply for a Class J permit and all you need to do is submit paperwork to the board, we'd encourage you to do that. However, given the state of emergency and the fluid nature of this situation, if you are unable to do that, the board will allow 2 pharmacies licensed in Missouri or another state to share services without a Class J permit. To also accommodate assistance in the state of Missouri, normally the rule would require that both pharmacies either be under common ownership or share a common database. The board is waiving that right now if that cannot be reasonably accomplished. Also, the written contract and required policy and procedure manual. We understand that negotiating a contract may take time, as well as writing a P&P manual. We want to make sure that you are able to use someone as soon as reasonably practical. So those have been waived in Missouri. If you are using a non-resident pharmacy that is not licensed in the state of Missouri, once again, you are required to keep proof that the non-resident pharmacy holds a current and active license in their home state. A couple of issues with sterile compounding, and Tom, please jump in if you have anything to add here. So since staff members are being moved around to meet the emergency, we had some questions about aseptic skill assessments that are required for compounding staff. We understand that media fill testing and those things can take days to return. During the state of emergency, the board will allow a pharmacy to accept or use an aseptic skills assessment from another pharmacy if you do not have time to wait for testing results to come back for your individual pharmacy. So a good example of that, you may be at pharmacy A, and pharmacy B also, both of you are compounding. You have a staff member that needs to move from pharmacy A to pharmacy B because you have technicians that are out due to illness or may not be traveling. That pharmacy technician may not have done a skills assessment at both Pharmacy A and Pharmacy B. Pharmacy B can use Pharmacy A's successful skills assessment. We would just recommend that you document that in your records. Reuse of garb. We know that garb right now is in short supply. We encourage you to talk with your supplier. Also consider measures to conserve supplies. You see some examples on the screen in front of you. If needed, if you need to reuse garb, the board is recommending that, and this rule requires that you follow appropriate aseptic processes to make sure that you're maintaining the compounding environment. We've heard recommendations from other states that that licensees test more often. It may be a good best practice, but we understand that during the state of emergency, pharmacy services need to continue. We want to make sure that you're able to do that. If you are reusing garb, revise your policies and procedures. Make sure you're training staff so they know what the new requirements are. And you also may want to assess staff before implementing it. You want to make sure that staff is aware and can properly garb under the new procedures. Critical Point has held a COVID-19 webinar that included some very good information for sterile compounders. Now, this is a private entity not endorsed by the board, but it may be helpful for those who are compounding. There's some USP guidance out on this as well. And of course, if you're licensed by another regulatory agency, you'd probably want to check with them as well, Department of Health, NRC, whomever that may be. Dispensing verified medication. The other waiver that the board issued on, actually, I believe this one was issued on today or last week. It authorizes technicians and intern pharmacists to dispense medication that has been verified by a pharmacist when a pharmacist is not present. If, again, the medication has to be previously verified by a pharmacist and approved for dispensing. That includes contents and the affixed label. Dispensing is necessary for patient safety and to provide disaster emergency relief. And the technician is supervised in compliance with proposed rule 20 CSR 2220-2.710. I'll give some more information on that in a minute, but I want to stress here that this waiver, Tom, if you could flip back for just a moment, I want to stress that this waiver is not intended to address just normal pharmacy staffing issues. If you have a staffing issue, you don't have a pharmacist present when something is ready to go out, pharmacy should be making a good faith effort to address that in-house. If, however, something needs to go out and needs to be dispensed, it's needed for patient safety to provide disaster emergency relief, the board will allow a technician or intern pharmacist to sell something or dispense something that has previously been verified by a pharmacist. If it's sitting in the will call bin, it's gone through the entire dispensing and verification process, it's ready to go. Pharmacist is called out to give care at another location, giving maybe an immunization, or has to move to Pharmacy B temporarily. Technicians can still dispense that medication if it meets the requirements. Next slide, Tom, I'm ready now. For those of you who monitor the Missouri Register, the board, prior to the current state of emergency, had approved 3 rules for filing. They were published in the March 16th Register. For purposes of the state of emergency, and you see them on the screen, the board is asking and or requiring that those who are using the waivers please comply with these rules as applicable. And we'll talk about that more in just a moment. Next slide, please. So I'll just move along there we go. Technician remote data entry. We've gotten a ton of calls about work from home. The board began working on this shortly after the federal declaration of emergency was made, and then after the state of emergency was made as well. We had to do some legal working on the back end, but the board did approve a waiver for pharmacy technicians and intern pharmacists. I need to note that a lot of these slides say technicians, but it also would apply to an intern pharmacist as well. To perform remote data entry activities from home, and Tom will walk through a list of what some of those things may be in a moment, but that is now authorized in the state if number one, we're asking that you comply with proposed rule 2220-2.725, and that is the remote data entry rule that the board previously filed. Now, under that rule, it requires sufficient technology to monitor the technician's activity. The board purposefully left this language flexible to allow pharmacies to determine within your professional discretion what you deem to be sufficient technology, but that technology does need to be in place. A method of communication between the pharmacist and the technician, so a way for you all to communicate. Pharmacists should use their professional judgment on what is delegated and or allowed to be done from home. You want to make sure that you're maintaining patient confidentiality. If the technician or intern pharmacist will have access to records, please remember your HIPAA requirements. You want to make sure that is maintained. And again, that applies to any Missouri pharmacy technician working at home. With the non-licensed waiver, that means, let's say you have a Missouri technician that lives in Missouri, they can work from home under the board's waiver. Let's say that same technician lives in Illinois and they're registered in Missouri, they can also do remote data entry from home. Under the unlicensed non-resident licensing waiver, if you have a technician who's registered or licensed in another state and not in Missouri, maybe pick a state, Arkansas, Oklahoma, California, even Kansas. If you have a technician there, they also can be authorized to perform remote data entry activities on behalf of the pharmacist, but you have to make sure you're supervising them. Some examples include obtaining patient histories, remote data entry, billing and insurance claims, handling, communicating with other healthcare providers, on prescription clarifications, prior authorization requests. Again, pharmacists should exercise their judgment here on what technicians are authorized to do, and you should also make sure the technician is competent to perform the activities that they're doing at home. If you have a new employee who has very limited contact and or training, they may not be the employee that you want to authorize to work remotely and do data entry simply because they may not have enough experience. They can transfer non-controlled prescriptions to other pharmacies, again, non-controlled only right now, and also manage inventory, including purchasing and ordering. Tom, did you have anything on remote data entry before we move on?
No, just pharmacists can also be doing all these things from home too. They've always been able to do those things. So we just want to make sure you understand that too. If pharmacists need to be working from home, they can do that. Pharmacists can do a lot more from home. The technician is limited. Anything that that only a pharmacist could do, such as counseling a patient, stuff like that, would not be allowed by the technician at home.
Sure, thanks. Good addition. So let's talk about remote product verification. This waiver is on the supplemental statement that was issued by the board today. The board was asked about remote product verification because we understand there are some staffing issues, of course, that are impacting pharmacies. The board authorized remote product verification if physical verification by a pharmacist cannot be promptly performed. And I want to take a minute here. Again, this waiver is not meant to address normal staffing issues. So your pharmacy is normally short-staffed, and now you're going to bring in other pharmacists to do remote product verification. This is not what this waiver was intended to address. We are, due to the state of emergency, which we all hope will end as early as possible, but you cannot get a pharmacist in the pharmacy to promptly perform the physical verification, and prompt dispensing is in the best interest of the patient. So patient can't wait. You are unable to get a pharmacist to actually do the remote product verification. Then the waiver kicks in. However, if you're doing that, you have to use technology that is sufficient to accurately verify and check both the prescription contents and the affixed label. Again, that technology piece is key. The technician, I'm sorry, that should not be there. Please excuse that. We'll edit that in the final slides. But you must use technology that maintains patient confidentiality as well. So you have a pharmacist there who is able to use technology to verify the full product that is now authorized under the supplemental waiver. Next slide, please, Tom. Again, and I can't stress this enough because this was an issue for the board. We believe that pharmacists in the pharmacy providing patient care and interacting with patients is the safest way to practice pharmacy. This is not a blanket waiver for normal pharmacy staffing issues. If you can find another pharmacist or wait for another pharmacist to come in or a relief pharmacist to come in, then you should do that. But if you're unable to do so, the waiver applies. Again, you'll see this written very strongly, and you'll see it in the supplemental statement. This is for those instances where prompt dispensing is in the best interest of the patient. This is a temporary emergency solution and should not be permanent. So as soon as you are able to go back to normal pharmacy operations, you should do so. So let's say on Monday you are unable to get a pharmacist in to physically verify, but by Tuesday you have a relief pharmacist who can fill in. You may have a pharmacist on quarantine who may be going out for whatever reason, may have to take care of a child, whatever that may be. If you can return to normal pharmacy operations on Thursday, then you should do so. Also, other elements of dispensing should be addressed by a pharmacist, either on-site or remotely. So you should still be verifying data entry, DUR, all of those things should still be done. Remote product verification can be done from another pharmacy, just to be clear, or can be done by a pharmacist from home under the emergency waiver. Of course, by technicians, this is never allowed. So the board has been asked, does this mean that a tech can prepare a prescription without a pharmacist present? And so the answer to that question is yes. However, it's only in those instances where remote product verification is needed. So physical verification of a pharmacist cannot be promptly performed. Not just that you have a pharmacist that's running late, or it's less expensive for you, to have a pharmacist at another site. This is not a cost savings measure, but you can't have someone there to physically verify. Prompt dispensing is in the interest of patients. You're using technology to supervise the technician. You are checking, a pharmacist is checking the final product, including the contents and the label. If you are doing all of that, then in those temporary emergency situations, then remote product verification is allowed. However, the technology must maintain patient confidentiality. Next slide, please. We're going to move on quickly through some of these just so we can get to questions. Let's see, I think we've done that. Again, I just reiterated again, this is not meant to be a permanent solution. We have a caution here. Even though you're allowing remote product verification, or a technician may be dispensing even when a pharmacist is not present, again, that's medication that's already been verified by the pharmacist. To the extent that is the case, remember the permit holder, the pharmacist in charge, and the supervising pharmacist, you are all still responsible for ensuring patient safety and making sure pharmacy services are properly and accurately provided. That is a very strong caution here. The board is not waiving a pharmacist's professional responsibility or their authority to supervise. The board is just authorizing an alternative means in the event of an emergency, should it be needed. A couple of other things that I want to talk about before we get to miscellaneous issues: prescription transfers. So as you know, the rule currently provides that prescriptions must be transferred within 1 business day of a request. We understand that that may be difficult for some pharmacies due to COVID-19 related issues. The board is asking that you transfer as soon as reasonably practical. You should be making a good faith effort to promptly transfer to avoid interruptions in patient care. So we are asking you again to please use pharmacy staff wisely, consider your workflow. If you can't get the transfer out within one day, the board understands. However, you should be doing that as soon as you can so that we can take care of patients. A couple of miscellaneous issues, and I want to start with telemedicine, but we anticipate there may be some information coming out from the Board of Healing Arts. So on the national and also on the state level, the governor's office issued an executive order that would authorize telemedicine. I would encourage anyone who's interested to look at the executive order. It includes a link to the rules and the statutes that are waived. However, essentially, if a prescriber is performing a valid telemedicine exam, either in Missouri or from another state, they are authorized to issue a prescription, and the prescription can be dispensed by a Missouri licensed pharmacy if it is otherwise valid. All other things still apply. Essentially, if the prescriber has a license in their home state, they're in good standing, they're doing a valid telemedicine exam, subject to the waiver, the prescription is valid and can be dispensed here. And if they're in the state of Missouri, though, if the prescriber is in the state of Missouri, they would still need a Missouri license to prescribe, physician, APPA, APRN, whatever that may be. The Board of Healing Arts may issue some additional guidance here, and so I would hold a lot of questions on the telemedicine piece because I think they may be able to add some information that would be helpful in the future. DEA on their website has indicated that they will allow telemedicine exams or evaluations pursuant to federal law and the federal state of emergency declaration, and that the prescription is valid. BNDD has confirmed that they will do that as well. Again, wait for additional information because I understand some may be coming. Compounding hand sanitizer for OTC use. Of course, lots of questions on this. The board issued a guidance statement. I think the first one we issued, it is authorized during the state of emergency. The board is asking that you comply with FDA guidelines. The FDA policy actually on compounding hand sanitizer, those guidelines have been updated, so you may want to make sure that you're using current guidelines. Also, we are getting questions about using different formulas. We don't have information on that, and we would suggest you contact FDA. Hydroxychloroquine and chloroquine, we are getting a lot of questions and emails and calls about prescribing and filling prescriptions for both of these medications, also azithromycin. The Board of Pharmacy and the Board of Healing Arts, actually, while we were on the webinar, issued a joint statement on this today. I'd encourage you to look on the board's website. It should post very shortly. If you're registered for the board's e-alerts, you have it already. Essentially, both the Board of Healing Arts and the Board of Pharmacy, they are recommending that prescribers and pharmacists use caution here. If you have an established patient who's already established on these medications, we do not want interruptions in their therapy for valid prescriptions. However, we have heard of prescribers issuing prescriptions for prophylactic purposes, also issuing prescriptions to family members, themselves, staff members, those kinds of things. We are recommending that pharmacists reach out in order to avoid medication shortages and to ensure appropriate dispensing. Reach out to prescribers. We've asked prescribers to please put the diagnosis or diagnosis code on the prescription to assist pharmacists to make sure that first of all, medication is being appropriately dispensed, and also to prevent stockpiling during this time. Especially during this type of state of emergency. While it is not mandated, we understand several states have limited supplies to a number of days. I think most common, I've heard 14 days. Board of Pharmacy, the governor's office has not done that at this time, but we would caution pharmacies that, as always, in your professional discretion, you have the ability to limit the amount dispensed. And so if you get a prescription for a 30-day supply of chloroquine, or if you get a prescription that has any extended supply, as always, you have authority to dispense a limited supply, 14 days, 10 days. That's what may be common in the market right now. The Board of Healing Arts in their joint statement is recommending 14 days for prescribers. So hopefully we'll get this message to prescribers as well. I can tell you that in discussions on this, I was very adamant that monitoring this situation can't solely rest on the hands of or on the shoulders of pharmacists that are already stressed given the state of emergency. So hopefully we were able to get some information out to the prescribing community. You all can't fill what's not being prescribed, and hopefully we can attack this from two different perspectives. Personal protective equipment. So we are getting calls from licensees, from the public, from pharmacies asking, is it required? Should the board require it? What should be done with PPE in the pharmacy? The board is monitoring this. This is an individual pharmacy permit holder decision right now. The board has no official recommendations on this at this time. We would suggest that you follow CDC guidelines as well if you haven't had a chance to take a look at those. So I know that's a lot of information in a very short period of time, but we wanted to make sure that we had sufficient time to allow time for questions. We're getting a lot of questions in the board office. We are going to, if you give us just a moment so that we can walk through some of the questions that have come in, we'll try to answer as many as we can. If you have a question, again, please, you can enter your question in the chat box, and we'll try to get to it before the webinar ends. Tom, do you want to start?
Yeah, I can go ahead and take some of them while you look at some of the other ones. Just to clarify, it's the question box, not the chat box on your toolbar.
That's it.
That we're using. So we got more questions on the hydroxychloroquine. Specifically, they want to know, are we implementing a limit like some boards have done? The answer is no, not at this time. The statement that just comes out did not put any hard limits on dispensing of those products. Someone's asking if their CPR expires at the end of the March and they don't have any way to get that renewed, can they continue to immunize? The answer is yes. You would just document that you weren't able to do it and get it done as soon as you are able to get it done. Someone's asking, are you allowed to have other healthcare professionals come into your pharmacy to help assist? An example would be an LPN. I believe at this time the board has not addressed allowing other health professionals in. If you wanted them to work, you could fill out a temporary, you could file a technician application right now. Kim, would you agree we do not have a waiver to allow another healthcare professional in?
Not right now, we don't.
Someone's asking, do you need to be a technician in case you need to use someone else to deliver medications? And this one is, they're asking it if it's within the hospital. Typically, I don't know what you mean by delivering medications. If you're talking about stocking a Pyxis, stuff like that, I would say you would need to be a technician. If you're just delivering something that is prepared for a patient directly to the nursing station, probably not need to be one during this emergency period. But if stocking a Pyxis, I would say yes, you would need to be a technician.
We are getting questions on hydroxychloroquine, and people are asking again, just because I see this question several times, will the board be doing anything to mandate or incorporate limits on supplies and or requiring the diagnosis on the prescription? So many of the states who have taken action actually had legal authority to issue waivers in the event of an emergency. The board doesn't have similar legal authority. We would have to go through the governor's office. Right now, we are recommending that both pharmacies and prescribers both consider the amount being prescribed, and also pharmacies consider and make a decision on how much should be dispensed. The board is monitoring that. I can tell you that we were in conversations with Mo Health Net over the weekend, and we'll be doing a conference call on this issue at 3 o'clock today. So please monitor the board's website for any updates. But for right now, we are just issuing a joint recommendation from both boards.
We got a question about waivers for out-of-state wholesale distributors that need to ship in an emergency shipment. The board has not addressed that yet. If you need an emergency shipment, you might reach out to me directly. The board does have a built-in waiver in the regulation for emergency shipments that would probably apply here. But if we haven't heard of any issues yet with that happening. So if you are having trouble, why don't you email me and let me know about that. We have someone else asking about, has there been any allowance on faxing of C2 prescriptions and then mailing the originals? This would be a DEA and BNDD exemption. I have not heard of that there is any kind of exemption yet for that. They can do an emergency telephone prescription, and DEA rules does not define what the emergency period is and what the quantity, doesn't have a quantity limit on it. So right now it appears if you can't get an original, having the prescriber call it in is the way to go under that.
Someone is asking about remote data entry sites, and the guidance statement talks about a remote data entry site located in Missouri, and they're wondering if a technician from Illinois can do remote data entry for a Missouri pharmacy. So we are coupling two things. So the proposed rule that was published in the March 16th register, it's not finalized right now. It does reference a remote data entry site located in Missouri, because that proposed rule was originally intended just for Missouri licensees and for technicians registered in Missouri. However, given the state of emergency and the non-license waiver that was issued by the board and approved by the governor's office, a technician who is in Illinois or in Arkansas or in Kansas who is working for a Missouri licensed pharmacy, if they are registered in the state of Missouri as a technician, they are authorized to do that, or if they are registered or licensed in that home state. So if they hold an Illinois license but not licensed in Missouri and they're a technician under the waiver, yes, they can perform that activity. They would need to do the emergency notification form, and they would also need to give that form to the pharmacy that they will be assisting, but that is allowed. There is one other scenario. So let's say you have someone who lives in Illinois and they are also a Missouri registered technician, then that would be allowed. We would keep them, they would be considered a Missouri registered technician, would not need to do the emergency practice notification form with the board. I know that that is a bit confusing. Hopefully we'll be able to issue some additional guidance on that. Someone is asking, where are the board's guidance and document statements maintained? Those statements are on the Board of Pharmacy's COVID-19 page. We are working to keep that updated as quickly as we can, but as you can imagine, state IT is updating sites for social services, mental health, literally every state agency. So we have some delays right now, even though they've been incredibly responsive. If you do not see a guidance document on the website, especially the statement, the joint statement that just went out, just give us a little bit more time. It should be posted hopefully within the hour.
And I will tell you, we've had people ask, where can you find the proposed rules? They're on the Secretary of State's website, but they also are on the back of the 320 board statement we released on 320. They were attached to the back of that document. Also, I ran out of time. I was going to email out all the documents, but we ran out of time to get that done before the webinar started. I will later today, I will email all the registrants a PDF of all these documents, so you will have them.
And we will be posting
Someone's asking
those rules on site. I'm sorry, Tom, online as well, independently. Give us until the end of the day. Those should be up independently as well as attached to the document Tom just referenced.
Someone's asking about a technician that just renews. That just applies? Do they need to renew on 5/31? It all depends on what is printed on their registration when they get it. You need to check the registration to see what the expiration date is. As we get closer to May, I believe some of those may be issued with a next year's renewal date, but I'm not for sure on that. Someone wants to know, is there any allowance to let a pharmacist take drugs and actually do dispensing off-site? As of right now, there is not a exemption for that. there are, right now the board has not addressed that. Would you agree, Kim, on that?
I agree, I do.
We have
Someone is
someone,
asking if the board will notify pharmacies prior to removing the emergency rules. Yes, because we don't want to interrupt transitions, patient care, and we also know that pharmacies will need time to sort of change their operations. So yes, we will try to give as much advance notice as possible.
we have a question about, does the waiver for remote product verification include sterile compounded products? It includes all compounded products, including sterile medications. Someone's asking what kind of documentation is needed if a technician is required to dispense something without the pharmacist there. We have not specifically addressed that. We would recommend that you keep some kind of record maybe of when that is occurring at your pharmacy. We haven't gone into any detail of what needs to be there. I would just recommend, just remember that they need to provide an offer to counsel, which can be in writing, we expect, with a phone number or some other way for them to get a hold of a pharmacist that can counsel them on that.
Someone has asked about giving an example of approved technology for remotely verifying medication, and ask, would a cell phone with video camera fit into this category on an unsecured phone line? Well, first, number one, you want to make sure you're HIPAA compliant and that you're maintaining information confidentially. Secondly, we are really resting this during the state of emergency in the hands of pharmacists. We trust your discretion. Please use your professional judgment to determine what technology you need to make sure that the prescription container includes the right contents, that the label is accurate. You also want to make sure that all data entry functions and all of those things have been verified. Pharmacists should use their professional judgment here. We do not have a recommendation on the type of technology, but remember, we want to keep patients safe.
We have a question about, can a pharmacist assist in the screening if COVID-19 screening kits become available to the pharmacist? They can assist, they cannot diagnose, and they cannot prescribe. So there's nothing that would prevent them from running a test. It's what you do with the information that you get from that test is where you're going to be limited. We want to know if a technician is working from home, is it allowed for them to do triage and run refills and determine what cause need to get to the pharmacist? The answer is yes. That technician would be able to do all those things from home. I guess the example would be you would transfer your pharmacy phone to a technician's phone.
Someone said that they just had a doctor order 60 hydroxychloroquine and asked if that was okay. This is a Board of Healing Arts issue. We can't say whether that's appropriate and or legitimate, but as always, within your professional responsibility, if you believe a prescription is not being issued for a legitimate purpose, then pharmacists, pharmacies, you have the authority and the ability to question that and or limit the amount of supplies that are being dispensed. I think a phone call in that situation would probably be a good suggestion, calling the doctor.
Someone is asking about, what's the board recommend for long-term care pharmacist consultants? Should they be going into facilities? That's regulated by the Department of Health. That's a requirement from the Department of Health. I would suggest you email them and ask them what they recommend, and I don't know if they've issued any kind of waivers over there on their side when it comes to long-term care facilities.
Someone has asked if tech licenses are being expedited to provide additional support. Once again, technicians can work once a completed application is in the mail. And so with the exception that we've granted for fingerprints, once that application is in the mail, you can go ahead and start the technician in the pharmacy. Of course, the board recommends that you make sure that they are appropriately trained. So hopefully that will prevent delays in staffing and allow you to move someone to practice as soon as possible. Someone has asked
some questions.
I'm sorry, Tom.
Go ahead, Kim.
Someone asked a question, and probably a lot more artfully than I described it. Can a pharmacy technician registered with the Missouri Board, employed by a Missouri licensed pharmacy, work from home if they live in the state of Kansas? The answer to that question is yes.
We got a variety of questions about insurance companies and 90-day limits and stuff like that. We cannot answer any questions related to insurance billing and what insurance companies are imposing on patients and pharmacies. So we're not able to answer those questions.
We have some questions about what can the board do to help pharmacists who don't have PPE and would like to have PPE in the pharmacy. I don't know what role the board can play in that right now. The board is still considering that. We would recommend that you talk with your permit holder. We understand supplies are short right now. I don't know that there's anything additional that the board can do on that right now, except that, of course, the board would recommend that we want to make sure that workers are safe, pharmacists, technicians, intern pharmacists, and are not exposed and are able to transfer illness as well. So permit holders that are on the webinar, that is something that you should consider.
We have someone asking, can they compound hydroxychloroquine for their regular patients if it's unavailable from their wholesaler? The answer is yes. You just need to document that it was unavailable from your wholesaler. Best way to do that is do a screenshot of their web page showing that it's out of stock, or an invoice that shows it's out of stock. But yes, you can you can compound that if you're unable to get that from your wholesaler. Someone wants to know, does a courier need to have a technician's license to do home delivery? The answer is no, they do not. Someone's asking, can a pharmacist working remotely print the prescription off at the pharmacy printer? The answer is yes, if your technology allows you to do that. Someone's asking about 340B regulations. That is not the Board of Pharmacy, so I'm not able to answer that question.
Someone has asked, can pharmacies begin delivering mail order prescriptions to avoid, or mailing prescriptions, I'm sorry, to avoid contact with pharmacy staff? Yes, that is authorized now. You don't need to do anything additional to do that. Someone asked if the delivery staff would need to be registered as a pharmacy technician. Delivery staff, people solely doing delivery functions, do not need to be registered as a pharmacy technician. Talk with your PIC, though, your pharmacist in charge. If they are performing additional functions, they may need to be registered.
Someone's asking, does the emergency dispensing waiver apply to schedules 3 through 5? No, it does not. BNDD and DEA would have to issue that waiver. Actually, both agencies would before that would be allowed. So the board's waiver does not apply to controlled substances. Someone's asking about if one of your staff tests positive coronavirus, what should the pharmacy do? The board has not issued any guidance on that. I would suggest you review CDC and the Department of Health guidance out there, and possibly also contact your local health department for guidance on how you should handle that.
Someone has asked if the board will ever mandate closing retail pharmacy windows and mandate drive-through only. That mandate would have to come through or with the approval of the governor's office. That is not something that the board is considering right now. Hopefully they won't have to, but as things develop, it's probably something that will continue to be considered.
This would be normally when we would end the webinar and send out, you get the survey for the CE. We're going to stay on a little while longer. If you have to get off now, you would need to email us to get the questions. If you want CE, you would send that email to compliance@pr.mo.gov and just say you're requesting the webinar questions, and we will email them to you. If you stay on the webinar, at the end of the webinar, they'll automatically come up on your screen.
Someone asked, are there any recommendations to support social distancing for patients, such as curbside pickup or utilizing drive-through? There are a lot of good suggestions that many of the pharmacy associations are circulating right now. And so there are pharmacies that are doing curbside pickup and drop-off, utilizing drive-through only. We would encourage pharmacies to make sure you're sanitizing as you normally as you would with any other issue. Make sure you're cleaning the pharmacy counters and equipment. We've been asked about technicians and when they sell and or hand out a prescription, deliver the prescription to the patient. Can they do that from a greater distance? The board's rules don't require, that patients and the technician or person selling the medication be within a certain distance. I think those are all good recommendations to think about. We've gotten actually a lot of calls about that, but I think they may be helpful.
Someone's asking, can a Missouri licensed pharmacy ship into another state during the state of emergency? That would be up to the state you're shipping into. We cannot give you authority to ship into another state if they require a license there without a license, but they may have waived it on their end. So you would need to contact the state that you're shipping into. Someone's asking, can you provide additional information on technicians working from home and what kind of equipment would be provided? I'm going to just tell you, if you have questions about, your inspector may be the best person to talk to because there are so many different scenarios of what's out there. So if you have specific questions on what's out, what needs to be done in order to implement a waiver, right now the board office is swamped. The inspectors are all working from home off and on during the day. They may not all be there at the same time, but they're the best, probably one of the easier ones to get a hold of and get an answer. So I would suggest you maybe contact them if you have specific questions about your pharmacy. We
Tom,
have someone asking about doing a different formulation for hand sanitizers. The board cannot answer that. That was an FDA guidance giving you the waiver to make these things without being an OTC manufacturer. We know there's formulas out there that weren't on that guidance, but you would need to get approval from the FDA on that. I know we've had lots of questions on this, and we're directing everyone to the FDA for an answer.
Tom, someone has asked if the board is relaxing its requirements on signatures for delivery. We've gotten a lot of signature questions. You want to answer that one, Tom?
Yeah, the board itself has no requirements for signatures. We do not require it. Insurance companies require signatures, but the Board of Pharmacy does not require signatures. So the board isn't relaxing anything, but we can't tell you what other entities such as your PBMs are requiring on signature deliveries.
Someone is asking, can a pharmacist test for COVID-19, or could they have a protocol to interpret and possibly treat people for COVID-19? So right now, our law doesn't address this, and the board law doesn't currently allow pharmacists to diagnose and or quote unquote treat. However, I can tell you that conversations are being held at the statewide level about all healthcare providers that might be available to assist in the event that there has to be a mass testing sort of process, and also, or if other healthcare providers are not available. The Board of Pharmacy has consistently said that pharmacists are an incredible and well-trained, educated healthcare resource for this option, and we have communicated that to the governor's office and to other state agencies as they talk about available healthcare entities. I can also tell you that your associations, all of the pharmacy associations, have been very vocal in advocating for pharmacists to be used as a vital part of this healthcare response. So right now we don't have anything that addresses that, but to the extent that it is being considered, we are asking the governor's office and other state agencies to consider pharmacists as a resource.
Someone's asking what kind of policy and procedure would be needed for technicians to do remote data entry. In addition to your normal policies of what would apply in the pharmacy, there would be some other considerations of security at their home. If there was a security breach at their home, and like another thing would be, how do they get a hold of the pharmacist? Because there has to be communication, some way to communicate. So in addition to your regular policies and procedures, those things would need to be covered. The technician would need to be trained on that, and you need to document that. The board just says it's up to the employer, the pharmacist in charge, to train them. We're not telling you what to train them, but those are some things you need to consider when they're working remotely. You would not be dealing with that inside the pharmacy. So keep that in mind when you're writing a policy and training your staff working at home.
Someone is asking, what should the pharmacy do if a pharmacist or a technician tests positive for coronavirus? That's not a recommendation that I think the board should give. There are a lot of resources out there from the Department of Health and the CDC about what to do if you have someone at the pharmacy test positive. One of the things that I would recommend, though, is that you make sure you have a reporting mechanism, not just for your individual employees or staff members, but also for their family members. So if they have family members or if they are exposed to someone who might have COVID-19 or has tested positive for COVID-19, it's probably a very good idea that you have some type of procedure in place for reporting that, because you don't know what you don't know. And the best thing that you can do is encourage reporting.
Someone's asking about transfer. Is there allowance to transfer medication between pharmacies? Actually, that's currently allowed under current rules. Pharmacies can distribute up to 5% of their normal volume without needing to be a distributor. So that's between other pharmacies, or between if they need to transfer something to a doctor's office like that. And there's actually an exemption for out-of-state pharmacies who can transfer something into Missouri without a license, as long as they are properly licensed in their home state, and the pharmacy receiving it keeps documentation that they held a license in their home state at the time of transfer. So there is no waiver needed. Those are things that are already built into the current rules.
Someone has asked, can a Missouri licensed pharmacy mail prescriptions to Illinois during the state of emergency? You would have to check with the state of Illinois on that.
Kim, someone's asking about, is there any registry of pharmacists who are able to work volunteer? There was some discussion of this on the board conference call. I believe it was yesterday or Saturday's one. I don't remember now. We do not have one. Kim, is there one in Missouri that you're aware of?
No, but this is actually something that all 50 states talked about on a call on last week, because we understand there are a lot of pharmacists right now who may not be working full time, who may be available to work, and also inactive pharmacists who may be willing to volunteer if allowed to come back to active practice. This is something that we were going to communicate out to the associations. I don't know what role the board can play in this. I can tell you that NABP, we understand, will be modifying the e-profile system to allow designation of a emergency practitioner, namely someone who is willing to work in another state if additional pharmacist help is needed. That was in the early development stage on last week. Hopefully we'll have more information on that this week, but there may be a way for you to register through NABP to notify either healthcare, other employers and or other states that you are available to work in the event of an emergency. But it's a very interesting suggestion, and it may be something that the associations could possibly help with, but we are getting several calls. On the inactive licensees, so we've had several people ask, can they go back to active status in the event they're needed for an emergency? Some of them have already said that they are needed to go back to active status. We plan on taking that back to the board. Actually had a question from a board member about that on today. Hopefully the board will have a chance to discuss that possibly this week. We'll let you know if there are any additional updates.
Someone's asking what kind of documentation is required to use these waivers. Some of them have on our slides told you, like if you're going to use a technician from out of state who doesn't have a license here, there's a form to fill out and submit to the board. That would be your documentation. Others, there is no requirement. If you're doing remote data entry, there is no specific, other than the training of the technician, there's no documentation other than you need to know where that prescription, you still have the normal records for dispensing that prescription, especially if you're doing remote verification a pharmacist still has to verify it, and there has to be a record of who that pharmacist was. So some of these don't have additional requirements, but they do, the standards requirements still apply to using that. If you have to, you know, it'd be a good idea to document what technicians are working offsite. I believe the rule actually says that in the rule, if they're doing remote data entry, you have to have a list of who they are and stuff. So read the rules. Some of those have that in there, others do not. It doesn't hurt to just document to be safe. It doesn't hurt to over document, but we don't want to burden you with all kinds of documentation.
Someone is asking, can we dispense full amounts of hydroxychloroquine for patients who were already on it for other conditions such as rheumatoid arthritis? The answer is yes. I think both boards, the Board of Pharmacy and the Board of Healing Arts, we want to stress that we do not want to or intend to interrupt patient care at all. If in your professional judgment you have an established patient who's on the medication, unless there's something else, there would be no reason that we would recommend that you dispense less than what is prescribed. That would include lupus and other things as well. I think that MoHealthNet, the government, the state, is more worried about those new prescriptions that we are seeing for prophylactic purposes and for individuals who are not presumptively or confirmed COVID-19 positive. I think that's where the concern is. So yes, if you have a valid prescription, would otherwise dispense, you have an established patient, then my answer would be yes, but please just monitor that because we want to make sure we don't end up in a shortage situation. Tom, it looks like we're getting to the end of our questions so that we can almost wrap up here. Do you see anything else that we might need to that we might need to look at?
No, what I would recommend is if we didn't get to everything, so there's just some things we cannot, we're not the agency to answer it, so we skipped over some of those. You can email your inspector, you can email me if you have questions. That might be easier than emailing the board office right now, and we'll try to get an answer for you. So if Kim, we can close the webinar now.
Well, I just want to know one more thing. Someone raised a very good point. The Show Me response, I think it is, for volunteering. So for those pharmacists, technicians, licensees, individuals on the call who might be interested in volunteering, the state does have a statewide volunteering network for healthcare providers. It's Show Me Response. I believe that once you are registered with them, they will give you information about areas of need, healthcare needs in the state of Missouri. So I think you can just Google Missouri Show Me Response and possibly get more information about being added to that volunteer register. I want to thank everyone. I apologize. We try to get to most of the questions. I understand this is a lot of information moving very quickly. Check the board's website. This is a very fluid situation. We just want to make sure of two things. Number one, that patients are being taken care of. That is the biggest thing. We want to make sure patients are safe. And we also want to make sure that we, from the regulatory perspective, move out of the way so that we can allow you all to properly take care of patients as easy and as quickly as you can. If you have any questions, again, please email the board office. Normally I would say call, but please email right now. We'll try to answer as much as we can. Thank you everyone for your time today.
So for those wanting continuing education, and I believe we have a lot of people on here that may have never been on one of our webinars before, to get CE, you need to answer the survey questions at the end. So what happens is when I announce that I'm closing the webinar, a screen don't close your browser. A window will come up telling you that the organizer has ended the webinar. Hit close, still do not close your browser, and a survey will pop up on your screen. We have reports over the time that people on tablets and phones sometimes may not get that survey. For anyone not getting the survey, you can email us at compliance@pr.mo.gov and we will email you the questions, but you must have your answers back to us within 24 hours to get the CE. CE, we will mail out certificates. Typically that's in 30 days, but I can't guarantee it right now if the office, with what we have going on in the office, when those will be mailed out. So again, later today, I will email out the documents we talked about to everyone who is registered. So check your email later today for that. So I am now going to close the webinar.